awareness from Trinidad and Tobago, Fibrome info from France, KMT Rising, Lake Health and Wellbeing, Noir Wellness, OH Counselling Services, and the Fibroid Forum. So, you know, those are the organizations who have committed time and energies to meeting regularly, to putting on the campaigns and this webinar. And many of the Global Fibroid Alliance members are here today. So just say hi, folks.
Hi.
Hi.
Hello.
Thanks for joining.
Hello.
Good evening.
Thank you for being here.
Hiya. Bonsoir.
Bonsoir.
Bonsoir, bonsoir. Sakafet, if anyone's here from Dominica, or Hetapu, any of Sarahs who are here. So the program today, we're going to do a short poll, and this poll is going to be get you warmed up into the whole Zoom kind of experience. We wanted to capture some information around your experiences around the fibroid subject, and it's totally anonymous. So very soon you are going to see a poll with a few questions coming up on your screen. So please take part.
As a pentament, say
Welcome everyone, and welcome those who are joining us now. There's a short poll if you'd like to take part that's coming up on your screen. I've just got a few more minutes to do that. Okay, so for those who haven't taken part in the poll, there's just a short poll that's come up on your screen. So 32 out of 53 so far have taken part. That's 60%. So anybody else, please feel free to engage in it. Just a bit of interaction, and it will assist us with some information really around fibroid care. Right, we're going up to 67% voted at this time. Let's keep them coming in. We're just allowing a few more people in. We've got 56 people online so far. If everyone can put themselves on mute, that might help with the so that we prevent the lag and the echoing in the background. Thank you. Okay, so we've got 72%. Probably got about 2 more minutes just before the poll ends. So if you haven't taken part in it, feel free. If we can mute ourselves so we don't have any background noise, that would be great. Thank you. Hi there. Just check whose mic is still on and assist them in muting themselves, please. Okay, so let's share these results then and see what's okay. So can everyone see this, the sharing of the polls?
Yeah.
Great. Okay, so we have the first question. Have you been diagnosed with fibroids, or do you currently have fibroids? And 73% of the participants are either been diagnosed or they currently have fibroids. Has the pandemic, the COVID pandemic, had a negative impact on your ability to manage your fibroid symptoms? 20% said yes and 80% no. Do you feel you've had enough support during this pandemic to manage your fibroids and their symptoms? 33% said yes, but 68% said no, not enough support. Are you aware of the possible link between fibroids and thyroid imbalance? And 83% said no, they were not aware of this possible link between fibroids and the thyroid imbalance. And if you have fibroids or think you have fibroids, have you had a thyroid gland function test? 83% said no, they have not. Okay, so that's really insightful. And one of our speakers will be talking a little bit around that link with thyroid and the fibroids in their presentation. So watch this space. So thank you very much for taking part in the poll. And I'd like to move over to Julia Mandeville now, who is going to be introducing our guest speaker, Dr. Fanta Waterman. Thank you, everyone.
Hi, good morning. Can everyone hear me?
Yes, yeah.
Okay,
Yeah.
great. It's my pleasure to introduce our first speaker, Dr. Fanta Waterman. So a little about Dr. Waterman. Fanta Waterman, PhD, MPH, obtained her Master of Public Health in Community Health Education and subsequently her PhD in Public Health with a concentration in Health Policy Management from Temple University in Philadelphia. Launching her career in public health systems and services research, Dr. Waterman has held leadership roles in health research evaluation and market access with positions in government agencies, consulting firms, large international biopharmaceutical companies, and startups. With numerous publications, Dr. Waterman is also a seasoned lecturer, having taught as an adjunct associate professor within the City University of New York from 2008 to 2013. She is the managing director of Serrette Brown Research and Consulting LLC, or SBRC, which is a boutique research consulting practice which specializes in epidemiology, population health research, program evaluation, evidence gap analyses, digital health, and publications development strategy. SBRC partners with nonprofits, non-governmental organizations, biopharmaceutical companies, health services research organizations, and policy implementation agencies based in the United States, Europe, and the Caribbean. SBRC staff have been the recipients of research awards and featured on national television. SBRC specializes in conducting research in emerging and underrepresented healthcare markets. Their client values the collaborative approach and knowledge of the nonprofit, public, and private sectors. They never underestimate the population in their efforts to achieve the best possible products and care. Dr. Waterman resides in New York City in the metro area. Off to Dr. Waterman.
Thank you so much, Julia. It's so nice to see you again. I've known Julia for a couple of years now. We've been able to work together on some projects, and with the pandemic and everything, it's nice to see you again. So thank you for that. And thank you for having me today. To the founders and the managers of the Global Fibroid Alliance. I just want to talk a little bit today about COVID-19 in general, and also dig a little bit deeper into the impact on fibroids. And I believe that there is a question and answer period that's built into the talk. And so I'd be happy to hear any questions that come from me or my co-presenters today. I'm just going to share my screen. And hopefully everyone is able to see. And as Julia said, the company that I represent is my consulting firm, Serrette Brown Research and Consulting. just a quick overview of what I plan to discuss over the next 15 or 20 minutes. We'll go over an overview of COVID-19 and I'll provide a status update on where we are in terms of cases and therapy. We'll go through fibroid management during a pandemic, and we'll talk about some thoughts around how we can go back into the environment and achieve a new normal. And then, as I said, we'll have plenty of time for questions. So just wanted to go quickly over sort of a timeline of where we've been and where we are today. But I'll start to say that COVID-19 stands for Severe Acute Respiratory Syndrome Coronavirus 2. It's a very long name, so there's no surprise that it has a nickname. But it was first identified in December 2019 by the World Health Organization in China. And by January of this year, we saw cases in Japan and France, and the virus continued to spread west with documented cases in Africa, North America, and Europe as of March of this year. And you can see on the timeline sort of how rapidly the number of cases were mounting up. By April, we had 1 million cases worldwide. And starting in May, we started to see some clinical trials for different treatments for COVID-19, as well as vaccine development, which we'll get into those details a little bit later on today. And as of today, we got Was there a question? Okay, but while we work that out, I wanted to take a quick audience poll before we get started to just get a sense of the participants on the line as to how many folks have been personally affected by COVID-19. So if you don't mind responding to the poll as to whether you have been diagnosed yourself or somebody close to you has been diagnosed. And we'll take a minute or so to collect those responses.
Yeah, take off my mic. So
Okay, so thank you. So it looks like we've got 40% of people on the line today that have been personally affected by COVID-19 and 60% who has not. So thank you for participating in that. This is a screenshot from the Johns Hopkins global world map that follows COVID-19. But as we saw on the first slide, at that first peak of cases were seen in China in the winter of 2020, and then it moved west very quickly to other parts of the world. And you can see here on this map that all of those red spaces are where there have been cases documented of COVID-19. I took this screenshot a couple of days ago, and so we're actually at a worldwide total of over 14 million COVID-19 cases reported worldwide, and the patients have been reported with COVID-19 in every continent in the world except for Antarctica in about 188 different countries. To date, there have been over 600,000 people who have died from complications of COVID-19. And in the United States, Brazil and India in particular, the cases are highest in terms of number of patients who have contracted the disease, and the United States, United Kingdom, and Italy report the greatest number of deaths so far. In terms of who is at risk of COVID-19, we've seen it affect people of all ages, races, nationalities, class levels. It really doesn't discriminate there. We have seen some trends where the virus is contracted, or we see worse outcomes in people of African descent or people with heritage in some of the Spanish-speaking countries in North America. We've specifically seen that in the UK, in France, and in the United States especially. But in general, people who are considered at greatest risk for COVID-19 are those patients who are over 55, especially those living in a concentrated environment of elderly people like a nursing home. And we also know that folks who have pre-existing conditions, respiratory conditions, or other chronic conditions like asthma or type 2 diabetes are at a greater risk from having further negative outcomes of COVID-19 disease. So COVID-19 is spread through person-to-person contact. We do have some examples of it being transmitted between animals and people. In fact, that's how it's believed to have started in the first place. But it's generally very, very contagious, and it is spread through respiratory droplets from coughing or sneezing. And the virus is believed to live in the air for about 3 hours and can live on surfaces for up to 72 hours. And this is why we hear a lot of public health people reminding us of the importance of reducing the virus, is disinfecting, washing our hands often, and wearing a mask. It's because of how the disease is most easily spread. Once the virus has been contracted, patients will experience mild or severe symptoms like the one that you're seeing here on your screen. And those symptoms may come up within 14 days of exposure to someone that has COVID-19. You see here fever, chills, cough, fatigue, loss or taste of smell, or nausea, congestion, or runny nose. So a lot of these symptoms look like the regular flu, but are actually COVID-19 symptoms as well. And some patients don't have any symptoms at all. And so when thinking about how the virus can be easily spread, we do have cases of patients who have the virus and spread it without showing any symptoms or before they start showing symptoms themselves. So once a person is diagnosed with COVID-19 or presumed COVID-19, they'll typically be given some instructions on how to manage the virus at home. So they'll be encouraged to stay hydrated, drink plenty of fluids. If they do have a fever, to take a fever reducer on a regular basis to keep that fever down, lots and lots of rest, and also continuing to manage any other condition they have, like asthma or heart disease or things like that. It's also very important that they quarantine themselves and don't expose themselves to other people while they're contagious, so that the virus is not further spread. Some patients, unfortunately, do experience worse or worsening symptoms of the virus, and they may receive an anti-inflammatory or an antiviral medication to help combat the disease. And patients who really are unable to fight the disease or experience even more severe symptoms may be hospitalized and have to receive oxygen or even go on a ventilator to help them with breathing. Right now, there is not a vaccine or treatment anywhere in the world except in China. There is one conditionally approved vaccine there, but there's nothing approved in terms of a treatment or a vaccine in the United States, the European Union, North America, or the continent of Africa, or in Asia. There is hope that there will be a vaccine available by winter of 2021. And if you look here, this is a link to a website from the Milken Institute. It's a faster cures think tank of the Milken Institute in the United States. And they've been keeping track of everything that's in development about COVID-19. So there's about 198 different vaccines that are currently being tested for vaccination. And then there are over 270 different drugs for patients who already contracted it that are currently being analyzed or in clinical trials. I forgot to mention at the beginning that I'll make sure that this deck is available to the Global Fibroid Alliance and the coordinators of this webinar at the end. And all of these links and information that I've attached are freely available anywhere. And so I hope that you can find them useful offline. But there are live links embedded in the talk. So switching gears a little bit, I wanted to talk about fibroids and then really dig into, how fibroids has been impacted by the COVID-19 pandemic. So as we know, fibroids are non-cancerous growths either in or on the uterus, and they can be of different sizes. There can be one or several of them. And some of them can cause symptoms like the ones that you see here on your screen, but some women report not experiencing any symptoms of their fibroids at all. And in fact, they're diagnosed with fibroids while they're being examined for a condition that's different entirely. There are different ways that if a doctor thinks that a woman does have fibroids or might be at risk for fibroids, it can be assessed. And so typically a doctor will start with a vaginal exam or a pelvic exam to look for physical evidence of fibroids. They may undergo an ultrasound, which is just a very, very painless procedure, which takes a picture of the womb to see what's inside. Sometimes a hysteroscopy is conducted as well, and that's a little bit more invasive, and so sometimes you may need some anesthesia for that, and that's specifically to look inside the uterus for fibroids. They can occur outside, and so a laparoscopy or a biopsy might be done, and in that case, an incision or a cut needs to be made to access the growth and see what's going on there. In terms of treatments, there are lots, and I know we'll hear a lot about the different opportunities for managing fibroids from my co-speakers, but there is diet and exercise. I think we got some questions about the link between red meat and fibroid symptoms, and alcohol and fibroid symptoms. There are pharmaceuticals or drugs. In the United States, actually, a drug for heavy bleeding associated with fibroids was just approved in May of this year. There is ultrasound surgery, which is a heavy vibration. It's not invasive, but it addresses and tries to remove the fibroid that way. Or there is surgery either by myomectomy to remove the fibroid itself, or a hysterectomy to remove the entire uterus. So before getting on to how fibroids might be affected by the COVID-19 pandemic, I wanted to take another quick question just to see for that 40% and for everyone really, since the COVID-19 pandemic began, if you've interacted with the healthcare system at all and in what way. And so if you could take a couple of minutes to review the questions and then answer, I'll give you some time. Okay, thank you. So we've got the majority having had no fibroid-related healthcare visits. And then next we've had a couple, 13% have had at least one in-office visit for their fibroids. And then we do see that some telehealth visits have been taking place as well, which is very, very interesting. So thank you for responding to that. COVID-19 has brought up an incredible amount of stress for a lot of people. And there's been lifestyle changes. People have been estranged from loved ones to avoid contracting or spreading the disease. There's been loss of income, and all of those stressors can really impact our hormone levels and our menstrual cycles. And it's really important to think about the impact that the response that we've had to take to this pandemic can have on our hormones and our menstrual cycles, because they're so interlinked with fibroids and fibroid symptoms and many pelvic disorders, actually, and the severity of those symptoms. And so it's really, really important that we're making sure that we're taking care of ourselves to avoid getting COVID-19. But I want to be sure that everyone knows, and it looks like everyone does from the surveys, that you've got to make sure that you're taking care of your health, especially where there are cases that typically you're being managed by a healthcare provider. So please do not ignore your fibroid symptoms or any of your comorbid conditions, whatever it is that you're managing for yourself. And here are just a couple of tips that will empower you, hopefully, to make sure that you can ride some of these trends that we're seeing with the various surges and whatnot, and still take care of yourself. So you want to be sure that you have an inventory of feminine hygiene products to make sure that you stay prepared as much as you can. If you have questions or your symptoms change, please contact your healthcare provider. We saw that some folks are going into the office and some are leveraging or using telehealth, which is great. Make sure that you stay on your treatment regimen. I know that especially with the stress and the change in lifestyle or even the change in income, we might have to make some changes to our social life or our lifestyle or how much alcohol we consume or the kinds of food. But it's really important to try to stay on track with how we're taking care of ourselves, the medications that we're taking, and staying in touch with our healthcare providers. Eat healthy and stay active. That's always great advice for everyone, but especially for women with fibroids, it's very important. And staying active and exercise is also very good for stress. And pay attention to your mental and emotional health. It's so very important in general, but particularly at this time, and particularly women who have taken on quite a bit of new or pressing roles in response to the pandemic in terms of family life and caring for elderly parents. Make sure that you're checking in with yourself, your mental and emotional and your behavioral health to stay safe and as healthy as you possibly can. And eventually we will all come out of this. And as we're in different parts of the world right now, but some parts are reopening and people are leaving quarantine. And there's a lot of question about, where you spend your time at work or at home, how you, re-engage with family, extended family, where your kids are going to go to school and how to go about, everyday activities and then outdoor activities. And it really is a very nuanced question. It's a very personal decision. And so here are some questions on the slide here that can sort of help you and your family and your loved ones assess where you are in terms of re-entering and leaving quarantine and what will work best for you and your lifestyle and your situation. And again, this is a source from the Texas Medical Association. It's a very useful tool that assesses risk. I'm going to try to bring it up here. There's various activities included, and it goes from 1 to 9. I'm unable to scroll, but as I said, you'll be able to access this link later. But there are various activities included and the presumed risk of contracting or spreading COVID-19 associated with that. And so that can be a tool for you as well to figure out just exactly what is the right step for you going forward. So if there are any questions, I'm happy to take those now or later. And this is some information to follow up offline if you think of anything after today. I've really appreciated the opportunity to speak with you all, and thank you very much.
Okay, thank you, Fanta. Thank you very much. We're going to open up for some questions now. There's also some questions that may be coming in from the YouTube as well. So if I ask Abby and Olivia, if anyone has any questions, if they can raise their hands. There's a function on the Zoom that you can raise your hands, or you can just pop your question in the chat, and Olivia or Abby can be fielding those for us, and what's coming through the YouTube streaming as well. So thank you, Fanta, for that sharing and that talk. And let's see what questions people may have. I mean, we'll have an opportunity once everyone else speaks as well to ask questions. Okay, one of the things was that came through was there's about the younger ages, Black women, and the fact that a lot more younger age groups are being affected by fibroids. Are you able to comment on that at all?
Yes, we are seeing a diagnosis of fibroids in much younger women. Traditionally, we saw diagnosis average age over 40, and we are seeing younger and younger. I think part of that has to do with just diagnostics and how much more awareness there is. There is a lot more empowerment of patients to be more vocal about their experience and their symptoms. And so they're being assessed sooner, which is good news. Doctors should be listening to their patients. There are also some theories and some research being done to see what about our environment is making women more prone to developing fibroids at a younger age. But I agree, there are younger women being diagnosed, and I think that's in large part because of awareness, which is wonderful. You shouldn't have to suffer in silence for many decades.
Thank you. Abby, Olivia, any other questions coming through the chat?
Hi, so yeah, hi, this is Abby, everyone. So I'm here looking at the questions coming in from YouTube. Not many questions. Hi, everyone on YouTube. We do have one question, which may or may not be one that Fanta can answer, but this question is, are there any particular concerns with fibroids and the menopause?
Yes, that's a good one. That's a good one.
Very, very good question.
Yeah.
Off the top of my head, I don't know of any particular concerns or any focus on those women. Menopause is a reduction of several female-related hormones in the body. And so my guess is that there is some impact, but I can certainly look offline and see if I can find any additional information on that. And I'll pass that along to the Fibroid Alliance, that they can post that to their website or send the answer directly back to you. I'll make a note of that.
Thank you.
I'm seeing some other ones come through, but Abby, were there others?
Other questions that are coming up in the chat. Let me just have a quick look. So I think Fiona has a question. She's popped her hand up.
Hi, thank you for putting me on. Yes, my question is this. I never knew of a relationship between the thyroid and fibroids. Now, I have a thyroid disorder. I have an overactive thyroid that at the moment is euthyroid, so it's acting normally. But I don't understand the relationship between the two. Can you explain, please?
I know that one of the other speakers is going to get into that in great detail, and so I don't want to steal her thunder, but I will say that the thyroid is a hormone regulator in large part, and so there's absolutely a relationship between them. And I think that maybe Olivia is going to get into that a little bit later. So if you bear with us for a few moments, hopefully you can get a complete answer.
Okay, thanks. Thank you.
Okay, there's
I think there's a few more questions in the chat. Should we take a few? Okay, so somebody is asking, what foods should be eaten to shrink fibroids instead of losing weight? I need to gain weight. So what foods are probably beneficial in terms of fibroids? Then we could come to these at the end, maybe. What do you think? Some of these at the end.
And also what we're going to be doing is pulling all these questions together and actually sending you out a sheet with the answers after the event as well. So don't feel that if we haven't answered your question directly, we will be responding to them.
Yeah, because I think Muku is going to be touching a little bit on food. So so we could take these questions if they haven't been answered towards the end. Just to touch a little bit on the menopause. So somebody's already put it in the chat as well. But
yes, that's great.
Yeah. So someone's already put it in the chat as well. But generally speaking, doctors sometimes advise, have suggested that after the menopause, because your estrogen levels are sort of decreasing, then your fibroids possibly may shrink after the menopause. But it's different for everyone. Okay.
Right. And again, I'm happy to answer questions offline, and we'll be available to work with you guys to pull that response list together. So thank you so much again.
Thank you so much, Fanta, for that. And yes, we will be responding to all your questions along the way, and there'll be an opportunity after all the speakers have spoken to get back to some of those questions as well. Okay, so we're moving on, introducing Candace Bryan from Noir Wellness, who will be introducing our next speaker, Makuu Quesoia. Over to you, Candace.
Thank you, Sister Amani, and greetings to everyone on the webinar today. Makuu Quesoia is a mother of a teenage daughter and a priestess in the Pan-African spiritual organization, Asar Aset Society. She is a qualified homeopath and a psychotherapist who has worked in a variety of mental health settings and now works on a freelance basis as a holistic health practitioner, integrating African-centered therapy, homeopathy, herbology, nutritional therapy, essential oils, and meditation in her work. She is devoted to formulating natural healthcare products for the whole body, internally and externally, and she is the co-founder of the company To Divine Natural Body Care. With over 20 years experience under her belt, Makuu Quesoia's psycho-spiritual approach to health integrates mind, body, and spirit to ensure her clients experience a whole system approach to health and well-being. As a priestess in Asar Aset Society, she is well versed in Qigong, yogic breathing, and in a number of ancient female-centered energy healing practices. She has the responsibility for formulating the Society's range of herbal tinctures, which are prepared based on the spiritual principle of divination, as well as the traditional knowledge of holistic healing sciences. Her understanding of health and disease and how to help stimulate a curative effect is implicitly influenced by traditional African-centered cosmology, which holds the fundamental principle that our nature is essentially peaceful by nature, and therefore we are divine beings. With this core understanding, Makuu Quesoia believes when we align ourselves to the natural laws of nature and strive to live in harmony with these natural principles, our life, our health, and well-being are enhanced. Therefore, she considers a lack of knowledge of self and our lack of union with the divine laws of nature as a primary cause of ill health. In more recent times, she is engaged in intense research with other leading homeopaths from around the world to help establish a homeopathic approach to COVID-19 and has been running COVID-19 clinic in London. Moreover, she understands medicine should stimulate the body's natural ability to heal itself rather than to suppress a condition, and that when medicine is derived from nature or close to nature and promotes prevention through diet and lifestyle, health is achievable and disease is preventable. It therefore gives me great honor to welcome our second presenter to the webinar, Makuu Quesoia.
Hi, Candice. Thank you for the introduction. And thank you everyone for inviting me to this panel today. So we're speaking about fibroids. Very common, yes, indeed. And we all, know somebody or have members in our family that suffer from fibroids as well as our own selves, which is why we're all here. So what I will say is that around 1 in 3 women develop fibroids. But what is really critical is about, I've just realized you haven't actually asked me to share my slides, so I'm speaking without my slides. Have you set that up already for me to share? Can you hear me?
Yes, you can go ahead and share your slides.
Hi, Makuu. Sorry, I sent you a text in the chat. Yeah, to share them.
Okay. Thank you. Okay, there we go. All right, so let's move on from there. Yeah, so what I was about to say is about 1 in 3 women are diagnosed with suffering from fibroids. And about 9% of those women come from the Black and ethnic groups. which is significantly high, and I am one of those women, which is why I, personally developed a keen interest in understanding what is a fibroid, what causes it, and how can I address it within myself naturally and also assist other women to do the same. So with that keen interest, I've spent a lot of years doing some research and also working with women in my practice, which has enabled me to come up with a protocol of health when working with women with fibroids. My approach to fibroids is an integrative approach, okay? It's about working with the whole person, okay? And not just their symptoms. And I do integrate, as Candice said, a number of different healing modalities, such as homeopathy and nutrition, which I won't list again. But the most essential thing here is that you're working with the underlying cause and not just the symptoms, because fibroids is really a symptom of an underlying process that has gone wrong within your body. And if we can identify the process of disease that is taking place within you, then you can begin to address things at its source, rather than at the end spectrum, where we tend to be, firefighting. We're always looking at the symptoms and try to address the symptoms at the wrong end of the spectrum. So in terms of how I work, it's really looking at how to address those symptoms much early on, and also looking at the underlying causes of them. But for the purpose of this talk today, because this is really a vast subject area, and to go into it and give it real justice would need more than the time that I've been allowed to have today. So what I will say before I go deeper into looking at my approach is that the underlying etiology of fibroids is still yet to be, determined by Western medicine. It eludes them. They don't fully understand. And I think as a result of not fully knowing, very little research and money is put into researching this condition. Okay. Let's move on. And so what tends to happen is that women get given the option of either a wait and see approach. You go to your GP with symptoms, they either give you prescription. So some women may be given painkillers or a combination of the contraceptive pill. Meanwhile, in all of these cases, your fibroids are actually growing. And as a result, you're leading up to a situation that becomes more chronic, because you're not addressing your issues at an earlier stage. You're adopting this wait and see approach. So I've just moved on a little bit too soon. So for me, when women come to my clinic, they're showing perhaps signs of a drug layer that initially I have to work with them to help to clear. So the initial approach to treating fibroids starts with the onset of a detoxification process that's looking at clearing that synthetic drug layer of either the contraceptive pill or the painkillers that they've been taking, or any other toxic chemicals that they may be imbibing through their diet, or even on an emotional mental level, because toxins isn't just about the environmental factors, it's also about other toxins that we allow ourselves to indulge in, such as our emotions. So the organs that I tend to focus on in the onset is the energy organ system of the liver and the gallbladder, which is paired with the liver, the kidney, the gut, and the thyroid gland, as well as the lymphatic system, because these are our major detoxification organs that help us to eliminate toxins. The number one organ being the liver when it comes to fibroids, because one of its major function is to help break down hormones, metabolize hormones, and in particular estrogen. So you can see that if the liver is not functioning at its optimum, it's going to have difficulty processing some of the excess estrogen that we women tend to suffer from. And this excess estrogen is commonly known as estrogen dominance. And whilst there's a lot of research that looks at estrogen dominance, part of the work that we as women need to understand is that it's not just about the excess estrogen. There are other factors, which I will talk about shortly. But to go in a little bit deeper about detoxification, I want us to just acknowledge here that there are many things that we can do to assist ourselves and to assist the body to help carry out that process. So it's about giving the liver that helping hand by taking certain supplements, like certain liver nutrients that contain L-glutathione, calcium D-glucarate, and taking certain eye antioxidants like hydrogen, which is a really critical, supplement that helps to cleanse the free radicals that build up in our body, that also then assists the liver to carry out that job in cleansing the body and expelling it via the colon. So there are certain supplements that the liver needs to carry out this job efficiently. Certain supplements like vitamin C, vitamin D, and K2. Again, paired with vitamin D3 and vitamin green tea. These herbs and supplements together help to break down fibroids because they're improving the function of the liver. What I also didn't have on here was supplements for the gut. As well as the liver breaking down harmful chemicals and helping to convert them to less harmful and toxic substances, its job is then to send those toxic substances to the colon, which is going to help eliminate them. But if your colon isn't functioning as well as it should, then you're going to need to assist it. So taking things like a good colon cleanse, taking probiotics will help to increase the overall efficiency of elimination so that you don't get a situation where your body is retaining toxins. And if your body is retaining toxins and is not expelling them, it's going to have to find a place to put it. And the reality is, you could consider a fibroid, a toxin that the body has deposited in a space, and the ideal space is your uterus, okay? So assisting the body to carry out its job is key. So let's have a look at the right. I'll continue. The endocrine system is a system that we're really here talking about. And this system helps to regulate the homeostasis of our hormones, okay? And it's really the interface between the physical and the emotional and the bioenergetic body. And what I mean by that is that we all understand that we have an energy system. In traditional Chinese medicine, it's referred to as the qi. In Western medicine, it's the life force. Okay. Now, the endocrine system has an affinity with the life force. It needs to be maintained in homeostasis. And what enables it to maintain itself in homeostasis is, sorry, just go back a bit, is the ability to be peaceful, okay? When we are not peaceful, then we struggle to maintain the homeostasis of the hormones, because our hormones are very susceptible to feelings of anger, fear, worry, anxiety. And these emotions act as endocrine disruptions. And they create an influx of hormones, either too much or too little. They affect the communication messaging system. So the pituitary gland that is meant to be sending messages to communicate for certain hormones to be released at certain times does not do that job as well as it could, because the endocrine system operates at a fine balance and it doesn't take much to disrupt it. Okay? And when the endocrine system is disrupted, we then see issues of a toxic overload. That toxic overload can be a number of things. Stress. And stress really is just our emotions. It deals with emotions of fear, worry, and anxiety. It's our poor diet, our poor lifestyle. Okay? These things come together and predispose us to being susceptible to developing fibroids. So as mentioned, the endocrine system is in health maintained through a fine balance, okay? And what enables it to maintain that balance is our ability to maintain our inner calm, our inner peace, okay? There are environmental factors that also elevates estrogen, such as cortisol, which is our stress hormone that is triggered when we are emoting, okay? We all understand that stress is not good for us and affects us adversely, but do we all understand how to overcome stress? Many of us are taught to manage stress rather than transcend it. And as a result, we struggle to transcend and heal in our person. We end up managing our symptoms instead of healing from them. So let's just have a closer look at some of the contributions to fibroids formation. There is a link between the uterus and the thyroid gland. The thyroid gland is a very important gland in the body that is part of the endocrine system, which is made up of nine glands in total. The thyroid gland helps to metabolize every cell in the body, including the liver, whose job is to metabolize estrogen. Okay, so you can see the link between the thyroid gland, the liver, and fibroids. Okay, and oftentimes when a woman has fibroids and she has surgery to remove her fibroids, it can then aggravate the thyroid gland because you're not actually dealing with the underlying cause, you're just cutting it out and removing it. So that can then take the issue up into the throat and develop symptoms of a thyroid issue. The thyroid and the fibroid are both sensitive to estrogen. Okay. Lowered ratios of progesterone. Now this is interesting because a lot of research is predominantly focused on the elevated estrogen. There's very little talk and research about the significance of the lower ratio of progesterone in comparison to estrogen. And I really want you to hear this really clearly because with the right levels of progesterone, estrogen is cancelled out. Your excess estrogen is cancelled out. But most of the time, our attention is focused on lowering our estrogen. And as a result, that imbalance of estrogen and progesterone doesn't get addressed. We don't do enough to bring up our estrogen. Okay. And not only that, many of us may have been on contraceptive pills, which affects our estrogen levels. And we may have been on those contraceptive pills since, puberty. So a long history of that drug layer creating that artificial profile then creates that chronic picture. Another factor or a possible cause is infection. Now, this is the least topic that is spoken about because it's quite a new idea or theory that infection could cause or could lead to fibroids. But there is some evidence that infection in the reproductive tract can lead to the formation of fibroids. And of course, diet and environmental factors can lead to the development of fibroids. But I'm going to suggest here that these environmental factors are not necessarily the cause, because if we have good liver function, our liver can deal with the vast onslaught of toxic chemicals that we imbibe from our environment or from the foods that we eat, if it's functioning at its optimum, okay? So then we have poor metabolism, which again takes us in connection to our thyroid. If we're not metabolizing chemicals and converting them into more useful substances that our body can utilize and promote wellness within us and expel those that we don't need, then we're going to retain those chemicals, and those chemicals will be built up in us as a toxin. And ultimately affects our adrenal health, which is a gland that is part of the endocrine system. So you see there's this domino effect that takes place in the endocrine system that needs to be in health, balance. And any slight imbalance, you see signs of an endocrine dysfunction, which your fibroid is part of. So natural ways to raise your progesterone. Vitamin B6 in particular is crucial for helping to raise progesterone, but essentially taking a good B complex and maybe a fermented B complex, even better. Vitamin C again helps liver function, helps clean up those free radicals. And then evening primrose oil, which is a good fat, your essential fatty acid. You know, you all may have heard of the bad fats, your cholesterol. Fat is essential because it helps to promote energy that is necessary for the synthesis of certain chemicals in the body and the synthesis of hormones. And then we have certain herbs like Vitex, which is a good endocrine system herb that helps to maintain the balance of the hormones. And then there's certain foods like pumpkin seed, sunflower seeds, kale, lentils, and dark chocolate. Good dark chocolate, kiwi and banana. Just to continue on this, from a homeopathic perspective, there's a vast amount of remedies that you can use that will also help promote the increase of progesterone, such as diarrhea. Diarrhea, also commonly known as wild yam. Wild yam has certain chemical compounds called phytoestrogen that has been shown in some clinical trials to be effective in combating cancer of the breast, tumors, and has also been effective for fibroids. Other herbs like dong quai, vitex, licorice root, rhodiola, ashwagandha, these herbs, when they're combined, work together to support the adrenal glands. And we need to support the adrenal glands because the endocrine system, as previously mentioned, is significantly affected by stress. And the adrenal glands is the gland that helps us to either overcome stress or is affected when we are overstressed. Okay. And there are a few supplements that I produce, such as the fibroid shrink formula and a women's restorative formula and the liver uterus cleanse, which is really important because, you know, as women, as we shed our cycle each month and we have our menses, oftentimes we don't always get rid of fully our menstrual cycle. We retain some of that blood. And oftentimes this will come up in the next cycle as dark old blood. So in our uterus, we have stagnant blood, and therefore there is stagnasis and poor circulation. And in that poor circulation, we're holding on to the toxins. So some of these herbal formulas will help to increase circulation and help the body cleanse from the toxins. So just moving on more about homeopathy and what is homeopathy. Homeopathy is a form of energy medicine. It treats the whole person and not just your symptoms. There are vast amount of remedies I could choose to discuss today, but for time, I'm going to look at a few. And what I will say about homeopathy a little bit more is that homeopathy works to stimulate your body's own natural ability to heal itself. So it's non-suppressive. It's not masking your symptoms. It's actually helping to bring symptoms to the fore and clear them naturally rather than to suppress them. So when we look at the remedy pulsatilla, the woman who needs pulsatilla, she's sensitive. She tends to cry easily. She tends to have changeable mood, and her symptoms are changeable. Her symptoms of fibroids, pain in the uterus, can be heavy, bearing down sensations. She suffers from leukorrhea, and stomach issues is a predominant issue of this remedy. There's a variety of menstrual issues. Her cycle may be too profuse, may be short, may be scanty, may be stagnation. Okay. She may also suffer from discharges, okay, which may be a sign going back to infection, leukorrhea. Okay. She may have a headache during or just before her cycle. So this is the woman who needs pulsatilla. And when we're looking at a homeopathic case of fibroids, we're looking to match a remedy like for like to the woman, okay? Unlike allopathic drugs, which is prescribing one standard treatment for all. Homeopathy is a very personalized, tailor-made prescription that suits you as an individual. And whilst fibroids affects us individually, we also understand there's a collectiveness about fibroids as we as women and Black women are susceptible to. Other approaches that I also employ are the use of essential oils. There are a number of essential oils that I use that can be taken internally and also used topically. Essential oils are sandalwood, geranium, and frankincense, to name a few. Frankincense is my go-to oil. I recommend it frequently to many women because there's lots of clinical trials in the use of frankincense and cancer, and in particular, tumors. So just to summarize the work that we do at Kinetic Therapeutics, we take a holistic approach to health. We offer a range of holistic modalities that we integrate. It's not just about homeopathy or herbs, it's about an integration of all of those healing principles, recognizing as people, there's no one thing that's going to assist us in our journey of healing. You know, the counseling is significant because of the emotional, mental issues that contribute and predisposes and make us susceptible to the formation of fibroids. It was previously mentioned by a previous speaker, the importance of COVID and its impact on us as women suffering from fibroids. And really this is about the stress, because when you think about it, COVID has raised in the Black community the issue of health. And it's raised the importance more than ever for us as a people to be more mindful and be more up on how we take care of ourselves, okay? In our clinic, we have come up with a protocol approach for treating people with COVID that has been effective. It's a homeopathic approach, and it's one that we, you know, encourage people to take alongside herbs and a diet, a good diet of eating lots of raw food, eating things like garlic, which is antiviral, various other supplements such as your NAC. There's a whole range of things that we recommend that contributes to a holistic protocol of health. But with all of that said, in terms of the supplements, the most important medicine that you could take is your breathing, okay? Our breathing helps to regulate our mood. It helps to calm us down, okay? We all know that when we are stressed, our breathing pattern changes. So if we're angry, our breathing pattern is different to when we are calm or happy. So being mindful of how we're breathing is key to helping to manage our emotional propensity and help us transcend those emotional conditions that predispose us to health-related conditions and make us more vulnerable to whether it be COVID or to fibroids. So I've come to the end of this presentation, and I'm happy to take questions now or at the end.
Thank you, Makuu Quesoia, for a great talk. Yeah, we have got a few questions coming through the chat, Abby, and also anyone from the live streaming. And for anyone else who might have some questions, please just raise your hand in the Zoom, and we will acknowledge you. So over to you, Abby, just to take some of those questions.
Okay, great. So we've got quite a lot of questions. So we have some questions that have come in from YouTube. So I thought I'll give our YouTube watchers first dibs with the questions. So somebody is asking, is a frequent cleanse an alternative to reducing or eliminating fibroids development?
Well, I would say yes, it is. It is an alternative to the conventional approach that is offered on by allopathic medicine, which is really a wait and see approach, or to have you on medication. And, you know, the most invasive approach is to have an hysterectomy, which really should be your last resort, and ultimately shouldn't really be on the table at all if you are taking an alternative approach, such as supplementing, helping to detoxify your body, and assisting to improve your liver function, assisting to improve the various energy organ systems that are working to help detoxify your body, so that it does that job for you. So you don't have to mechanically have your fibroids removed. You can let the organs that are there to do that job do it well.
Great, thank you very much for that. So another question which has come in from the Zoom chat is, so I can't pronounce this word, I'm very sorry for the person that put the question together. There's some studies referring to donquai as estrogenic and not recommended for fibroids. Does it depend on the individual? And how long would it take to shrink large fibroids to a manageable level through the proposed natural approach?
Okay. Well, firstly, there is a lot of, mixed communication about herbs that have what is referred to as phytoestrogen properties. Now, phytoestrogen properties are similar to the natural estrogens that are in the body. They're not identical, they're similar. And research has shown that these phytoestrogens have certain medicinal properties. Certainly in cancer patients, we've seen tremendous benefits in helping to reduce tumors. So there is research evidence that shows that these herbs can be effective in treating women with fibroids. And if you could also tell me what was the rest of the question.
Oh, the rest of the question was, let me see, sorry, let me go back. How long would it take to shrink large fibroids to a manageable level through the proposed natural protocol?
Mm-hmm. Okay. Well, it really does depend on the individual. Okay. If you've had your fibroids, for 10 years, you cannot expect to have your fibroids gone in a few months. Okay. And that would apply to any health condition. It's a consistent and disciplined approach, recognizing it's not just about any one thing. It's not just about taking, herbs. It's about a whole lifestyle change that one has to adopt to assist them in ridding themselves of fibroids. And it's also looking at the underlying cause in you as an individual. And the underlying cause can vary depending on the individual. So in our clinic at Comedic Therapeutics, we're working with women to empower them to help them identify the various conditionings within them on an emotional, mental level and on a physical level that has predisposed them to this condition.
Okay, great. And then I think there are two questions. Two people have their hands up. So should we go for Phyllis first? So Phyllis, you could unmute yourself, or I could unmute you.
Okay, thank you so much for everything today. But I wanted to see the role with epigenetics and the environment, considering that over 90% of the conditions, including fibroids, are often environmental and mental, emotional. So what's your take on it being passed from our ancestors as we manifest the same behavior with it being in a gene?
Okay, so epigenetics is something that can be changed. Okay, is the first thing I want to say. You know, having something in your family makes you have a susceptibility, okay? But it doesn't mean just because you have the susceptibility that you're going to therefore have it. You know, we have to look at the errors of living that opens up your susceptibility to whatever it is that is in your makeup to have that condition awakened in the first place. You know, so it's not just about thinking because something's in my family, therefore I'm going to get it, okay? There's a lot more, you know, that you can do to ensure that you don't awaken your susceptibility to any condition, okay? And epigenetics is part of that in terms of diet. And if you're eating the right foods, you can change your predisposition to certain conditions.
Yeah?
Yeah, and I hope that answers your question.
Oh, yes, and gives me a lot of empowerment. Thank you.
Okay.
Cool. And then I guess, Imani, should we take just one more?
Yes, please.
Okay, Fiona.
Muku, Dr. Molson, thank you so much. That was such an informative and engaging presentation you've just delivered. My question is about a comment you've just made in relation to infection of the reproductive tract. Could you elaborate on that? And the fact that if you've got some kind of infection that you're going to see discharge, could you expand further on that, please?
Sure. You know, the vaginal tract and the reproductive tract is protected by what is called our good bacteria, you know, our microbiome, which in itself is a vast organ of its own that, you know, needs to be supported because it protects us. It protects our immunity, it protects our brain health, but also it helps to eliminate the buildup of certain toxins in our body, like yeast. If we have enough good bacteria, then, you know, that tendency to have yeast infection, candida, is eliminated, okay? So when I speak about leukorrhea and discharge, it is on that level where a woman, because of her good gut bacteria, may well have more of the bad bacteria than the good. That makes her more susceptible to hosting bad bacteria. And when that bacteria travels up the reproductive tract and up into the uterus, that can cause complications. There is a research that is being done. It's new. It hasn't as yet been publicized, but the findings of this is pretty, you know, telling. And I would suggest, just based on my experience of working with women who present with symptoms of leukorrhea, that there is a connection. So things like probiotics and having a good colon cleanse and taking multi-minerals are things I routinely put women that present to me on.
Great, thank you.
Thank you very much. Thank you.
Thank you. Thank you very much, Makuu Quesoia. And I know this is a lecture in itself that could take 2 hours. And we'd love to invite you back at some point to do so. But thank you for sharing. And thank you everyone who's been posting in the chat. And I've reassured people that we will get an opportunity at the end after Olivia's talk to answer a few more questions. And we will be pulling together all those questions and answering them in a fact sheet after the event as well. Okay, so thank you, Muku. If you could just share the screen back with me by stopping your share. And thank you. Okay, if anyone wants to have a comfort break, feel free to do so while we just get settled over to Corys AQ Nancis, who is going to be introducing our next speaker, Olivia Holtmann. Over to you, Corys.
Thank you so much, Imani, and pleasant afternoon to everyone. So it's afternoon everywhere now for those of us on the western side of the globe, those for us in the eastern, those for us in the north. It's a pleasure for me this afternoon as a member of the Global Fibroid Alliance to introduce the final panelist for today. She is Olivia Holtmann, a self-employed, accredited, humanistic integrative counselor, 13 years experience in various fields and areas, including identity issues, stress management, phobias, cultural issues, grief, domestic violence, sexual abuse, post-traumatic stress symptoms, the African and the Caribbean community, and young people, to name a few. Olivia is also a clinical supervisor and an EMDR therapist working with trauma clients. EMDR means eye movement desensitization reprocessing. She is passionate about self-development, and she takes a holistic approach to her clients, believing that no one approach fits all. She established her own practice, OH Services, in 2010, where she provides counseling, EMDR, supervision, workshops, psychological employment support, and facilitates therapy groups. She's also a part of the Global Fibroids Alliance. To everyone this afternoon, again, it is my pleasure to introduce, welcome, and to now hand over to Olivia Holtmann.
Thank you very much, Corys. Thank you very much. So I will be sharing my screen now, right, Imani? I assume so. Oh, I'm not allowed to. So I will wait.
A slight delay.
Okay, there we go.
Over to you, Olivia.
Yeah, thank you. There we go. Okay. Well, thank you everyone for joining us on a sunny Saturday afternoon as well, in London anyway. So thank you for taking your time. So I will be covering emotions and fibroids. And it's one of those topics that people want to run away from because people don't always like to speak about the emotions. And as was mentioned before, we don't really learn how to deal with stress or emotions. So sometimes we just tuck it away. And when I was first asked to do a workshop on fibroids and emotion, I don't know how many years ago, but a few years ago, I was trying to do the research because I didn't know that much about fibroids, and there was such limited information about emotions and fibroids. And I was very amazed. So I decided to call my friends just to ask around, to be honest. And when I started to look around or ask around, I noticed that more than half of my friends had fibroids, and I didn't even knew that. So that sort of showed as well that, you know, we don't talk that much about these kind of things. Oops. So today I will be covering the basic, what are emotions, because I like to always start with the basics, so everyone, because we do speak a lot about emotions, but sometimes it's still not really understood what it actually is specifically. I'm going to link a little bit women with emotions, and then fibroid in emotions and going through lockdown, not specific COVID, and ways to move forward. So what are emotions? So in psychology, it's an emotion is often defined as a complex state of feeling that results in a physical and psychological changes that influence thoughts and behavior. And when it comes to the body and our life in general, nothing happens without emotion. So everything is connected. That's why I like to work holistic, just like Dr. Makuu Quesoia was saying. You know, everything is linked. You know, what you think is what you feel. When people come to me, sometimes it's surprised that I ask them so much about, you know, not just the emotions, but also what they eat, the environment, you know, the relationship. So I'm trying to get a better picture about it because everything is connected. And the absence of optimal emotions can lead you stranded. So it's just like a car. If a car doesn't have engine, it just stops. If a light bulb doesn't have the electricity, it doesn't work. So everything is really connected with emotions. And we have fear-based emotions, but we have love-based emotions, so pleasant and unpleasant emotions. And usually when we speak about emotions, when people come to therapy, it will be the emotions that are unpleasant or fear-based emotions. And that can lead to fight, flight, freeze, and friend. I'm not going to go too much into details, but you know, when we go through a traumatic period of time, or maybe in shock, even COVID, you know, in lockdown, it's a shock to the system and everyone reacts different. And there's a part of the brain that's called the amygdala that will react to that. It's like an alarm bell. And when it sees a threat, so if it would be in lockdown, for example, or COVID is seen as a threat, it's the unseen threat that we have at the moment. You can't see it, but it's there somewhere. And everyone will react differently to it. So the amygdala will say, you either fight or flight. I assume most people heard of fight and flight. So fight is literally fighting and flight is running away from it. And then some people freeze, which means you can freeze your emotions, you can even freeze pain, your body, memory. Some people get numb. And then you have the friend, which probably doesn't really make a lot of sense if I wanted to link it to COVID. But friend is when you, for example, are attacked by someone and the amygdala tells you, you know, befriend this person. And we don't have control over that split second when the amygdala decides that. So it happens very quick. The amygdala says there's threat and we react to it. And then when we calm down, you know, the cognitive comes in. That's why some people think, why didn't I flight? Or why didn't I run away? Why didn't I fight? But in that moment, you don't really have you know, you don't have control over that. Only afterwards, when you calm down, your cognitive thoughts come. And the subconscious mind or body is an automatic response on your thinking, feeling, and acting, as I was saying before. So everything that we think, our body will react to it one way or the other. Anything, especially living in a very hectic environment, sometimes we don't even realize our body speaks to us. So if you have a headache or a stomach ache or even a pleasant feeling, the body is telling you something. And I always say to people, try to make a profile of yourself. So finding out what the triggers are. So when your body speaks to you, then you can understand what is going on for you. And that is quite important. So good and bad, if there is good and bad, some people, you know, might say that there's no good and bad, there's just experiences. But good and bad is an interpretation of mind. We all can be here right now, something happens, and one person might be fine, and the other person has a trauma. It's the same if you would walk on the road and there is a car accident that you're not involved with. Some people have secondary trauma and some people will go home and they just go on. So sometimes it's an interpretation of how you experience it, which can be based on your past. It could be based on your experience in life and what obviously your culture as well. So it's an interpretation of mind as well. And when emotions get stuck, they become physiological issues for your body, and they can create symptoms, negative symptoms sometimes. And all emotions, good or bad, are a form of an energy, because we are energy. But the negative ones are letting us know that something is out of balance. And then obviously the opposite is that the positive ones, you know, give us most of the time a balance. It's sort. So unresolved emotions. So unresolved emotions, they get stuck in the nervous system. So what I was saying before, you have, the part of the brain that is the amygdala, it's like an alarm bell. And when we don't resolve our traumas, for example, or overwhelming feelings or shocking situations, it gets stuck in the nervous system. And emotional issues can carry a powerful charge capable of affecting our biology in a profound and often undesirable way. So for example, there are some research that say that unresolved emotions, they're often associated with gynecological problems such as fibroids, ovarian cysts, and excessive menstrual bleeding, because the body must express itself. So something has to get out, something has to be released from it. So women, they have like an additional emotional center. Men have it as well, but with women it's a little bit slightly different. So the uterus is that emotional center, and it is like a port that, it's an excess of emotions. So when we get nervous, for example, or even happy, when people are in love, they get butterflies. When you have to go on stage, like when I had to come on, I could feel this thing going on in my stomach because of the nerves of speaking. So, emotions, they tend to go in, in that uterus area. And emotions are also connected to needs and desires. And if we speak about women, women are carers, they are organizers, they're mothers, they are the root of, the home, and they do quite a lot. And often when I listen to women and the amount of stuff that they do and don't even sit still and think about themselves is amazing. And, we don't tend to think about ourselves first, especially as mothers. So we put our needs aside, we put our desires aside, and all of that is held within as well. There's no expression, there's nothing that you can, that you will do to maybe express that. So walking around with, those needs and desires that are all like bulked up and not expressed. And then mentioned before, emotions can be passed also genetically. And I don't have to go into it because Dr. Muku already explained that part of it, but it can be a linked emotion as well. And linking it to fibroids, in a sense, is if we think about Black women and the generations before us, and if we think that women, they hold the household basically, and they don't connect that much to their needs or desires, or don't express them. If genes can be passed on, then you can only imagine what we are walking around with. And obviously we don't have to have all of that, but it's, some of us will more and some of us will do less, but it's keeping in mind that that might be there as well. And some research say that heavy bleeding is often associated with prolonged I can't speak anymore, internalized sadness and with health emotions. And if you think about the cycle that we have, our monthly cycle, I'm sure that most of us can go through that period of time where we just don't have any patience and we just snap, and your mouth is just kind of lippy, because that period of time, they say, is really where all the emotions, and you can do quite a lot of work in that period of time to get those needs and desires and emotions coming out. And some women also experience that in that period of time with a cycle, they feel quite sensitive and they want to cry, and it's very tense. And that is the time where you can do a lot of healing as well. It sounds strange because it feels that you're weak, or it feels weak because we're in pain sometimes, or we're moody sometimes. But at the same time, that's the period of time where you can do quite a lot of healing at the same time as well. So it's keeping in mind that emotions are stuck in the nervous system, but also our needs and desires are quite linked to that as well. So how do fibroids affect our emotions? I will name a few that you might have before fibroids, and some of them that you might have after the diagnosis of fibroids. And the reason why I go in so much details is that sometimes people feel stuff and they don't specifically know what it is. And they don't specifically know what it's linked to, because some people obviously have PMS and the symptoms are quite similar. And I like to unpeel stuff so we understand ourselves more. So we know exactly if it's anger and not maybe, for example, frustration, because for me that's quite different. But some people just feel this big lump of emotions, but they don't know what it is. And sometimes by unpeeling it, we can understand ourselves better, and we can look for the triggers. So when you know what the triggers are, you can put something in place and then, challenge that and change obviously how you feel about stuff and how you react to stuff. So before you know it's fibroid, you might fear of the unknown, because you know something is happening to your body, but you don't know what it is, and it just feels kind of strange. And then if you might been gone for tests or anything like that, you might be anxious because of the result. You don't know what it is, or it feels very bad, but you don't know what it actually is. And negative thoughts might come up of the worst case scenario, but then obviously will trigger anxiety as well. The loss of control, so not knowing what to plan, not knowing what to do or to expect. Feeling hopeless, because again, you don't know what it is and you don't know how to treat it. Things that you try might not help. So you feel hopeless because you're losing control of your life, you feel maybe. And then you have the physical pain. Physical pain can be, it's pain management. How do you manage the pain? You don't know when the pain comes. If you, for example, have pains during your cycle, then normally people know, a week before or 3 days before, so you know when it comes. But if fibroids, it just happens and you don't have control over that. So that can also make you moody again. It might make you feel quite snappy, depressed, some people even. And some people, when pain is there and you still have to go on with life, you still have to take care of your children, you still have to take care of the household, you still have to go to work while you're in pain, mentally it can be quite heavy if you don't know how to deal with it. And some people can go and have more serious mental health issues because of that. And then vaginal examination, that is a big one where people don't really speak a lot about as well, because it can be linked to previous maybe experiences of sexual abuse or sexual assault, because it's quite sensitive. Obviously, it's quite intrusive to do the test. You might not have anyone to come with you because you don't want to speak to people. So that can bring flashbacks of, if you have any experience of any assault, it can bring up a previous experience that you might have had, then that will add to what you're already feeling. And if you already would have a diagnosis or you find out what it is, then you might have a fear of the fibroids growing back. Or you might feel anxious about and worried about work because you need to have time off all the time because of pain. And some people actually can't leave the house because of the pain. If you don't have an employer that is understandable, then you might think you might lose your job, or you might get this tick or warning, and you still need to get money. And so it really triggers into all other fields of your life as well. And then there's worries about getting pregnant, because before you didn't know what it was. You might not have that idea that, oh, I can't have children. But to say as well that with fibroids you can have children as well. But I know that's a big thing that, that some women can't have children, or are worried obviously if they will be able to. And the fear of going back, I put twice, I see now. Treatment decisions. There is so much information around that you might not even know what to do. Usually when you look at fibroids, they might say what it is, and then they have a list of loads of different operations that you can do, or medication. And obviously some people might go to the natural way of healing, and then the food and all of that. So it's really doing a research and investigation for yourself to see what suits you, because what works for one person might not work for someone else. But to have loads of information and not knowing what to decide can also make people stressed out, nervous, hopeless, all the other stuff that I wrote down, and that can be then a trigger again of a roller coaster of of worry, which then also adds to the pain, to the stress, to the fibroids as well, because stress is a big factor through it. And then some general symptoms that you can have. So there can be a loss of focus, your family duties, socializing, you might not meet with friends again, the daily tasks goes out of hand as well. Pain management, there might be some disassociation. So disassociation might be that you numb the pain, because some people can actually disassociate in a way that they just don't feel the pain anymore, which can obviously be good in the moment, but on the long term it can be an issue, because if you then don't connect what is happening with you, with yourself, it can have a big impact on the long term. And disassociation, I always say, when people disassociate, or all of the coping strategies, they are very good, but you have to be aware it's just a way of coping. That's why I like when Dr. Muku said that, you don't look at this, well, not that you don't look at the symptom, but the root is very important if you want to really go in and heal and recover fully. Because working on the symptoms is fine, and we can do it for quite a long time, but it doesn't mean that it's gone, the actual root of it. So with the pain management, disassociation is quite a big one that people might not realize that is there. And this is not going to next year. Mood swings linked to the pain. You might feel the pain coming up, or it's just there, and then your child might come and ask for something, or your partner, and you just snap. At work, you might just snap because it's just too much to take on, and you need to get on with life. People get panic attacks, so they find it difficult to breathe. That can sometimes happen even when I was talking about the vaginal examination, when you have flashbacks and memories come back, you can go into panic when things can get too much. Lack of self-esteem. So lack of self-esteem may be linked to your partner. Getting intimate can be a problem. So you don't feel confident anymore about yourself, and it can lead you feeling helpless because you don't know obviously what to do. Irrational emotions linked to mood swings. PMS, if that is something that you then have as well, then it can get quite confusing. What is what? Is it the PMS? If it's the fibroid? Is it something that I ate? Is it, or am I just, depressed? Disbelief. Disbelief is linked to disassociation. So disbelief is, oh, I can't believe this is happening. For example, I can't believe this is happening to me. Or why me? Disassociation already covered. Insecurity, that is linked to lack of self-esteem. So you don't feel secure about yourself. Your body is changing. You're shocked because why is this happening to me? And then there's fear of relationship breakup, fear of losing your job, fear of leaking. So you might fear that you might leak in the car or at work, or if you leak at work, you have to go to a shop to buy, new underpants, stuff like that. Body image, your body is changing. Might be that people that you want to go for a child, but you found out that you couldn't, but then it looks like you're pregnant, and people asking you if you're pregnant, for example. That is quite a big thing, and that will lead to the insecurity and not being as social as normal. You stay at home, so you isolate yourself, trigger into depression, mood swings, and all of that. The overweight is obviously linked to the body image. Some people gain a lot of weight and might look pregnant, feeling unattractive because of that. And then sexual function, I already mentioned in relationship. It might be that, there is issues within the relationship because of that, if your partner doesn't understand. And it's quite important to see if you're able to discuss these kind of things, obviously, if you're in a relationship. So if you have a mood swing, or if there is anything happening that, your partner can understand what is going on, so they can support you, even your children, if they have the right age as well, even at work, if you feel confident enough. So I found this article because when I was doing the research a few years ago, I literally could only find 3 links based on fibroids and emotions. So I had to go a whole different way of getting my information. And I found this article in the Essence, the link is just there at the bottom. And it's from Denise Hilton, it's a holistic coach and doctor in Florida. And she says it's easy to connect the dots between emotions and fibroids. It elevated stress levels and emotional trauma can cause the energy or chi that runs from the liver through your genitals into your lower abdomen to store. And not releasing emotions, anxiety, and stress can also negatively impact your body energy levels. So when chi or the energy becomes stuck, blood along the liver channel tends to do the same very thing. And there's a stress and unexpressed hurt and transfer from our spirits to our body. So I like that because it explains it in what I basically say in a nutshell as well. And then she has another quote that I'm going to share, if this wants to move, yeah. So releasing memories associated with any trauma is a welcome opportunity to allow energy to flow more freely. Not doing so keeps us stuck in a stagnant place ripe for fibroids. So ending the cycle of self-sacrifice with introspection, look deep into what you're suppressing or experiencing, you're holding on to, and weigh down your spirit. And as I was saying before, while we're going through that monthly cycle, that work of sort of looking within and within your womb can be very, very helpful. It's maybe not the easiest thing to do, but it's, you know, if you're ready to do the work underneath, then, you know, it's looking at self-sacrifice. Women all over the world have been sacrificing so much, you know, and we're holding so much, and we think it's okay to do because that's what we do. You know, we care for people, we do for people, we organize, we always there for people. So it's almost like a natural way of obviously living, but at the same time, we forget about us a lot. And sometimes when we used to care for others, it's difficult to look at us. You know, we can put the makeup on, put the hair, and, you know, get your hair did and everything, you know, but what happens within, we hide very well. So it's really being honest to yourself, and that can be quite a difficult thing to do for some people. Just to say that the picture is not Denise Hilton. I just realized later that it's a picture, but it's not her. I just added that. I had that before. Lockdown. So why I call it lockdown, I'm almost finished because I see the time. Lockdown, why I call it lockdown and not COVID is because I feel that with emotions, it's more lockdown that caused the emotions and not maybe specifically COVID when it comes to fibroids. I know that probably most likely that, you know, because underlying issues that could be an issue as well. But lockdown caused probably quite a lot just being in the house for people. So being in the house can be a challenge to express your pain while you're with others in the household. So, you know, managing your pain. So you can't maybe do the things that you normally do or have the space that you normally have to sort of deal with your pain. The same with your emotions. You know, it's a challenge to express your emotions while there are others in the household. Your coping strategies are not available. So you can't go to the gym, you can't go to your classes, you can't go to therapy. How do you motivate to do those things at home while others maybe are around? The shops, very restricted. At some point we couldn't get what we wanted to get. Your food routines goes out of place. So it affects your fibroids as well. So your normal support system is breaking down, and you get lack of motivation because of not being able to use your coping strategies. So the household depends more on you, and the expectations not taking care of you, but for others and your family. You have more mood swings because of the coping strategies that are not in place, and you're feeling exposed because, you know, the household might not know your condition. So you have to keep up experiences, or you have to smile when you're in pain, or you can't really explain what is going on if people don't really know how much, you know, what you're going through. And then you're by yourself. So not being able to go to hospital appointments being cancelled because, especially in the beginning, now it's probably changing more likely, but in the beginning, everything was on lockdown. So how do you get to your appointments? And you have to then cope by yourself. So there's no support, there's no service available. And of course, the fibroid reacts to stress. So there's more pain and there's more bleeding. And then the other side of it is that you might cancel your appointment because the fear of going to hospital, because of what is happening in the hospital, obviously as well. So different ways to heal. So you can educate yourself about the condition in regards to fibroids, but also in lockdown, you can sort of find out these kind of workshops can be healthy. I saw on YouTube people changing details already. I saw here that someone put their details down. So it's nice to connect in this period of time with people as well, to sort of learn more, but also get the support. Relaxing and breathing techniques are quite good, and grounding techniques. So when we feel, the pains, we can sort of ground ourselves, or when we have doubts, we can ground ourselves. Exercise is quite good, and sometimes writing. Some people writing can be, can do the opposite, but some people can write it off. And it doesn't have to be that you have to write about your pain, but sometimes you can actually write about positive things and have positive affirmations to yourself as well, and write the positive affirmations. Talking to people, talking to a partner, friends, family. There's still online therapy as well. And that is still all available, which can be quite helpful in this period of time. Use positive thinking techniques and try to have a holistic lifestyle. So thinking about what you eat, who's around you, what's your environment, is your workplace not toxic? So trying to see mind, body, soul / spirit to see how you can find different ways of doing that. And the healthy eating was covered as well, to see what you can eat. That is quite helpful for you. So this is a slide that I saw in the beginning of lockdown. I think it's nothing to do with specifically fibroid, but I think it's quite helpful to see when lockdown happened. A lot of people were in the fear zone. It said there, toilet paper went crazy and stuff like that. So everyone was in the fear zone, a lot of people. And then you go into the learning zone, trying to understand and identify your emotions a little bit more, and evaluate the situation and see how it can work for the future. And then you got the growth zone, where you then, okay, well, we're in lockdown, COVID is happening, it's out of control, but what can I do for myself to keep control? And that is important to I always say with COVID, the main thing that you can do is take care of you, build your immune system, because we don't know where it is or what it is. It's this unknown thing that is there. So I'll leave this for a bit for you to have a look, maybe to see where you are in the zone and where you can go, or where you maybe can have an extra zone to grow.
Thanks, Olivia.
And then the last one is just thank you for listening. And then I have a 4-week course that starts in September, and it's literally linked only to emotional impact of fibroids. I call it a journey to self, because even though it's linked to fibroids, but you will start to realize so much more about yourself in regards of your emotions and relationships, and how your relationship is to yourself. So it's really doing more grounded work to sort of emotionally look deeper, but also seeing obviously how that's linked to fibroids, and start a new journey for yourself as well. So thank you for listening and having me on as well. I hope there's still enough time.
Thank you so much, Olivia, for that. Thank you so much for the sharing. And love the information, and also love the slides, the beautiful slides as well. The amount of care and energy you have all put into your slides has been phenomenal as well. Just a few questions directly to Olivia, and then we're going to open up some general questions for any of the speakers or Global Fibroids Alliance to speak to. So Abby, are there any questions that have come through specifically directed for Olivia's talk, please? And then I'll go to some of the ones that have come up a bit more generally.
Okay, so we don't have anything specific for Olivia from the YouTube group. I think the only thing I saw in the Zoom chat was around what exercise might be best for fibroids management.
with exercise would be fine.
Like yoga, Tai Chi.
Yeah.
Yeah.
I would say yoga, but Pilates is quite good as well. It's for the core, to work on your core, and at the same time as well, it's looking what works for you, because I might say yoga and you know that might not specifically work for you, but in general that exercise is just good to stretch and to for your body to help to I call that to sort of energize yourself, because sometimes, especially when it's lockdown, we're in the house, we don't do that much, so your body gets quite stiff. So that movement in general is quite good. But I know that some yoga postures are quite good, because it's not only working on the stretching, but it's also working on the internal part of our body. So I would say yoga to start with.
Yeah, that's absolutely right. And what you were sharing earlier about that life force energy, chi, you know, there's a lot of energy cultivation and qigong and tai chi as well, that directly works on the meridian channels, and the liver is one of those that, you know, can lead to stagnation, etc.
We have a good question here. Sorry.
There was just a few that Muku had wanted to respond to. One was about the alcohol effects, and also about why Black women may be more affected. So I don't know if Muku could speak to those, because they came up much earlier, but we didn't get to talk about them, but they seem to be recurring themes. Muku, would you unmute, please?
Hi there, I'm talking away and I'm muted. Sorry about that. So yes, the question of whether alcohol can aggravate or should you drink alcohol if you've got fibroids. It's very important that you understand that alcohol is a toxin, okay? And not only that, it also, you know, can cause inflammation in the body. But more importantly, in terms of its effect directly to women with fibroids, is that alcohol inhibits an important enzyme that helps to break down fibroids. So if you are imbibing alcohol and you do have fibroids, you're going to find yourself deficient of a necessary enzyme that is there to assist you in breaking down estrogen. And you know, there are a number of issues around why the body, you know, is not expelling estrogen. And I think this is a factor in that many of us are deficient of enzymes and need to supplement with enzymes, because we tend to eat a lot of cooked food. So we're eating a lot of dead food. We're not eating enough live food. We don't eat fermented foods. So a diet that is rich in fermented foods, rich in probiotics, will help to increase our enzymes variety that will assist us in breaking down chemicals in our body. So that, I would say, that's essential, that you minimize, or if you can, avoid drinking alcohol, especially if you have fibroids.
Was there another question? And the other one was around why so, you know, disproportionate level numbers of Black women in particular getting fibroids. What could be some of those contributory factors?
Well, there is, you know, some research that suggests that a deficiency in vitamin D is linked to Black women with fibroids. You know, Black people in general do not uptake vitamin D very well. And therefore, you know, we need to supplement. And the fact that, you know, being in the Western world is not necessarily our birthplace, where we don't get much sun, we're going to, you know, feel the brunt of not having enough vitamin D in our system and the effects of that. Vitamin D plays a major role in every process in the body, in every cell, and in particular aids in detoxification of the liver, which is why it's part of our fibroid protocol, combined in particular with green tea. So it's essential.
Thank you, Muku. Thank you very much. Over to you, Abby, for any further questions, and then we'll get to a winding down of the webinar. Thank you.
Okay. Okay, great. So we do have a question specifically for Olivia. So Olivia, somebody has said, I think you mentioned release memories, and she wanted to know how best to do this. How do you release memories?
Release memories.
Yes.
Let's
Oh, is
say
it? Maybe you didn't say that. I'm sorry. I think she said Hilton says release memories. How do you release memories?
release memories. If I
Yeah.
understand the question right, with release memories,
Mhm.
so I mean, the way that I understand the question, I would think, is the memories are obviously maybe a trauma, right? That's what I, correct?
Yeah, yeah.
Yeah. So if you want to process a trauma or release a trauma, sometimes it's going back to what has happened. And, you know, sometimes people can just talk about it and they go back to those emotions, connect to those emotions. Because when people sometimes disassociate from emotions or sometimes even memories, then at present, you're affected, but you don't notice it, or you notice it, but you don't know what it is. So it's all going back to what has happened and connect to that emotions. And, you know, processing EMDR is very good for that because it brings you back to that situation and release it. You can also do, in regards of fibroids, for example, you can do a specific meditation where you sort of connect with your womb and go back to the first memory of, for example, when you feel where the fibroid has started. And in the meditation, some memories might come up. And it's connecting with that emotion to sort of see what is emotion, where it's coming from, and what it is, in order to let it go. I mean, I can share the meditation if they wanted to sort of do that. But I would say, you know, you have to release the emotions by going back to, you know, connect to the memory, which can be quite painful, but it can be quite helpful to do because you don't have to sort of you don't have to live with the emotion anymore. So when you go think back to the memory, you know, it might still be distressing, but it doesn't affect your daily life anymore. I hope I answered the question because I think that's what she was asking, I assume, because I
think so. I think so. So thank you very much, Olivia. So I'm going to just look at a couple of more questions that have come in either through YouTube or the Zoom chat. So they're going to be directed at all of the speakers. And also if any members of the GFA would like to answer, then feel free. So the first question that I'm going to put towards everyone is, are there different stages where you think certain things could help, or maybe, or when it, or it may be too late? So I think what they're getting at is there a certain stage or size that your fibroids would get to where maybe it's too late in terms of doing something natural, like changing your diet? So the question is, are there different stages where you think certain things could help, or when is it too late? So I don't know if there's anybody that can take that question.
Yeah.
Anybody?
Sure, I'm happy to respond to that. You know,
okay.
The quick answer to that is that it's never too late to take an active role in your own well-being, you know, or whatever stage you're at in your health issue. It's never too late. You know, the thing is to be disciplined and to be consistent with that process, and to, you know, recognize that, you know, it's a process, and a process usually has a beginning, a middle, you know, and an end. So wherever you are in your process of journey of healing is where you begin in that, and it's never too late.
Hi, this is Fanta. Just to follow up on what Muku has said, I completely agree. I think that particularly in some cases, surgery and really the most invasive approach is often what's recommended, especially from traditional allopathic medical providers right off the bat. And a slow, natural start, changes to lifestyle, changes to diet is always the best place to start at any point that you're diagnosed. But there is sometimes some pressure to go to the most invasive things. Sometimes people's personalities are such that they really want to go to the most invasive, severe, cut it out and be done with it approach. But it's never too late, I agree, to start with measures that are not so severe or extreme.
Okay, thank you, Fanta. Thank you, Muku. So another question, it's come up twice, and I don't know if I could put Bridget, sorry, Bridget, on the spot, because I think you had some thoughts about this procedure. So somebody's asked, are you aware of the accessor procedure for fibroid treatment, and whether basically if that's a good option? So I don't know if I could put Bridget on the spot. Sorry, Bridget. Or is anybody aware of the accessor, and what are their thoughts on it? No.
I can share, I spoke with a practitioner who does the accessor procedure. She is based in Atlanta, Georgia. And what she expressed as it relates to persons who are interested in preserving fertility, her opinion is that she believes it's safe, she practices it, but they currently cannot advertise it because they don't have FDA approval, so they have not done sufficient surgeries to meet the quota for FDA approval. However, in one of our more recent webinars where we had a specialist doing a presentation, Dr. Cindy Duke, she has a clinic in Las Vegas. She was expressing that she likens accessor to embolization, and embolization is not something they recommend for persons who are interested in preserving fertility because it interferes with the integrity of the uterus ultimately in a way that they essentially might not be able to manage. So that's it in a nutshell.
Okay.
Yeah, but the specialist I spoke to is unlike accessor trained. Her place is called the Fibroid and Pelvic Wellness Center in Atlanta, Georgia. I could always share her information after. She's also a woman of color, but she does the procedure, and she said she's comfortable enough that persons have done it unconceived, because that is always the concern. But because of the numbers, I guess, as it relates, as I said, to FDA approval and the numbers, they do not advertise it and make that link because they don't have the approval, but it's something that they're working on.
Okay, wonderful. Thank you, Clarice. Wonderful. Thank you very much. So I'll do one more question, which is about recurrence. So what are the chances of the reemergence of fibroids if they're surgically removed? So if anyone can take that, any of the speakers?
Sure, I can speak to that.
Okay.
A number of my clients and people I see in my clinic have had surgery, and they've represented, looking for an alternative approach because their fibroids have returned. So fibroids do return. You can have surgery, have them removed, and they grow back. It's also important to understand that many women are often told, especially if they're over 40, don't worry, your fibroids will soon shrink as you go through menopause. And again, this is, not necessarily the case, because there are women in their menopause who still have elevated levels of estrogen and low levels of progesterone, which makes them susceptible still to having fibroids or for their fibroids to be growing. So, the reality is that it really is about your ability to engage with taking, yourself on that healing journey, to heal yourself, do your research, seek professional help. And, this is something that you don't have to do alone as women. Oftentimes as women, we tend to, do a lot on our own. We're strong Black women. We want to do everything by ourselves. We don't seek help when we need it. And we end up, resulting in a more chronic situation for ourselves because we're not reaching out to each other or reaching out to the relevant signposts where we can access the real help and support that we need. So I would say, seek help sooner and, get the help and support you need.
Wonderful. Thank you very much, Muku. So I'm going to hand back over to Imani quickly.
Thank you so much. This bird seems to be wanting to fly. We have had such a wonderful webinar, and I want to thank all the presenters, Dr. Fanta Waterman, Makuu Quesoia, and Olivia Holtmann, and all the Global Fibroid Alliance team in pulling this together. We want to thank you, all the amazing participants, you know, who have stayed the course with us. There's many other things you could have done on a Saturday morning or afternoon, depending where you're living. And thank you for being on this journey with us, really, towards wound wellness and general health and well-being of our nation, of our communities. You know, there is a last slide that Abby's going to speak to now, but we just wanted to say how much we appreciate you and where we plan to go from here in terms of what next. Thanks, Abby.
Okay, wonderful. So also just like to echo Imani's thanks to everyone. So just want to say a big thank you to all the speakers. Thank you to everybody that's joined us today. So we are really, the Global Fibroids Alliance, we're really here, we're a new kind of collaborative, and we're really here to advocate on your behalf. So please do keep in touch with us. The best way you can do that is by signing up to our mailing list, and I'm going to put the link into the chat in like 2 seconds once I finish speaking. So please sign up to our mailing list just to be kept up to date with our upcoming events and also campaigns. What we're also going to do is that we're going to send you a link to a recording of today's event, but it's also on YouTube so that you can have a look back and review the presentations today. If you have any questions for us, please email us gfa2020@mail.com, and we'll try our best to answer any questions that you have. The questions that we weren't able to answer today, we're going to pull it all together, and we're going to try and put together like a FAQs and try and answer all of those questions and send that out to everyone that attended. So really just thank you so much. So as I said, we're going to really try and continue with developing our approach to advocating for women globally. We want a global approach as part of our remit. So we're trying to look at global issues around fibroids and how we can all come together to address those issues. So keep in touch. If you have any suggestions on future events, please do let us know, and any suggestions on topics that we can cover. Also, we have a feedback form. I'm going to put the link into the chat as well. So if you don't mind completing the feedback form, that would be very, very helpful. So thank you so much for attending today. So I'm going to put those links into the chat right now before I forget. So here's the link to the feedback form here. And then I have the link to the mailing list. So if you wanted to sign up to our mailing list so that you can be kept informed of all the work that we're doing, that's here as well. So that's the mailing list. So thank you so much, everyone. Have a good rest of the day.
Take good care, everyone.
Thank you. Bye.
Thank you, everyone.
All
Yeah,
right,
thank
take
you.
care, everyone.
Thank you very much.
Thank
You're
you.
welcome.
Thank you to everyone.
Thank you for putting this together. It's been absolutely amazing, so informative, so engaging.
Oh,
Thank
good.
you.
Absolutely. Absolutely.
Thank you very much.
Bye, everyone. Bye, GFA ladies.
Okay, bye,
Take
Clarice.
care.
Take care, everyone.
Take care. Bye.
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 I'm so grateful. Thank you so much for all of your efforts. You're amazing.
You're very welcome.
Indeed, it was great.
Thank you.
Thank you, everyone. Take care. Bye, Makuu Quesoia.
Bye-bye.
Bye, Makuu Quesoia. Candice.
Oh, take care, sister.
Bye, Candy. Oh, you can stay on if you want, Candice.